Welcome to the Manifesting Health series. I'm Curry Bordelon, your host for this discussion. The Manifesting Health series provides engaging interviews with experts in men's health. Today, we're excited to have Dr. John Nelson join us for this episode, Meeting the Health Needs of Male Adolescents. Dr. John Nelson is an associate professor and Francios-Xavier Bagnoud Endowed Chair in Community and Family-Centered Care at Rutgers Health School of Nursing. He has extensive experience in caring for adolescent and young adult populations with a focus on HIV and AIDS research and care. Welcome, Dr. Nelson.
Thank you.
Thank you for joining us today. We really appreciate your time. So as we get started, I want you to spend a little bit of time talking about how did you end up in this space? Tell us a little bit about yourself and what got you in this specific area.
Well, I will. I have type 1 diabetes since I was 5 years old. And so I grew up having to see healthcare providers, and I wasn't so thrilled with the whole process. So I wanted to go into pediatric healthcare, and was pre-med and decided what I didn't know any nurses. And the only nurse I knew was an older woman. And so I thought, I needed to be a pediatrician, but I worked at a pediatric hospital and learned that the type of care I'm best at is nursing care. And so I went to a post-baccalaureate degree program at that time and became a registered nurse, and then got my master's of science in nursing through the same program to become a pediatric clinical nurse specialist, and wanted to work with kids and adolescents with chronic illnesses. And my first job offering as soon as I graduated was in the first adolescent HIV clinic in New York City. So I took that, and it redirected me towards HIV specific care or HIV related care. And I went on a 24-year journey of providing care to adolescents at different university-based health centers and adolescent HIV programs, as well as working with street youth, and working at a high school-based clinic in Queens, New York, and then for a couple years in a pediatric emergency room while I finished my doctorate in nursing, and then continue doing clinical care, but have entered into doing research, primarily focused on HIV-related care and HIV-related prevention.
Thank you, John. That's a great history, and it sounds like you've been in many different spaces to give a little diversity of thought when it comes to where our pediatric patient population has come over time, but also in location. So can you spend a little bit of time talking about the state of, male adolescent care? Where are we now with not only preventative, but treatment side as well, not with a specific disease process, but treatment in general? Like, where are we in the care spectrum of male adolescents?
That's a great question. And I think it's the same regardless of what disease process you're talking about, whether it's primary care, other unknown chronic health issues, to somebody with multiple chronic illnesses who is a child or an adolescent or a young adult. First, I'm just going to clarify, there's a lot of different definitions of youth and children, but in general, in pediatric nursing and pediatric medicine, 12 and below is generally considered a child, although you could have an early adolescent who is progressing in their sexual maturation process, and so they may be as young as 9 or 10 years old. But in general, 12 and younger is considered pediatrics, and then from 13 through 24 years old is just considered adolescent young adult. And that's because in males, brain development ends generally by 24 years old. So during that time of 13 to 24, excuse me, there are a lot of changes that are happening physiologically, as well as psychosocially and mentally. Excuse me. So, what we see in that time period are the leading causes of morbidity and mortality are the number one cause of death. When you look at that overall age range, are non-intentional injuries from 13 to 24. But number two and number three have been increasing over the years and are quite worrisome. Number two is homicide, and number three is suicide. And among children 1 to 17, gun-related violence is since 2020, the number one cause of death. So depending on which age group you look at, that they kind of bounce, they change from one cause of death to the next. Among Black adolescent males, homicide is the leading cause of death in this country, and has been for several years. And then among lesbian, gay, bisexual, transgender, queer, unquestioning, intersex, and other individuals who are not cisgender, heterosexually identifying, suicide is the leading cause of death. So LGBTQ plus adolescents are significantly at higher risk of suicide. And we've also seen an increase in Black male suicides over the last few years. So suicide and homicide are major considerations for adolescents and young adults. The majority will not experience those, but we need to be asking in our healthcare settings and then helping them address the issues that are leading them to those beliefs or those feelings. So mental health is a huge problem and among this age group, and has been. When we look at survival rates for other chronic illness, adolescents do pretty well once they get past 12 years old. So we're not seeing the leading causes, at least. There's still, adolescents and young adults still die from chronic illnesses. But what we're primarily seeing is, and this has been for the last 20 plus years, preventable morbidities and mortalities. And these should be addressed through our healthcare system, whether outpatient, inpatient, community-based, and it is not adequately being addressed, as we know.
So thank you, John. This is you touched on two very important pillars, and there's many other aspects and many layers to it. You specifically talked about the mental health of this population, and I'm willing to say it's vulnerable population because it's so malleable and there's so many opportunities for influence and risk behaviors associated with that. The mental health in this population, what role and how much influence, and we know this, but we always need to reiterate it, does social scenarios, social media, electronics, what role does a lot of this play in the mental health and wellness? And then after that, I want to spend a little time talking about physical health and wellness.
Great question. Everything impacts mental health. So everything we know that having peers, peer bullying, peer isolation from peers, and social media is a huge influence on self identifying and self-image, which are huge. We have to remember that adolescence is a period going from a child where you kind of take what, especially when you're younger, what your parents or guardians or the adults in your life tell you. Well, don't think that way, or do this. This is the right way to dress, or whatever it is. But then you start questioning authority and you're identifying who you are. But this is the way I feel. This is the way I am. I'm different than you, and you differentiate. So I always think of the thought of an adolescent who is tough and cool, but still carries, still takes a teddy bear with them to college. So it's kind of like that in between period of time. So we really have to accept their individualization and support it, however that is, while at the same time providing a bigger safety net around them, because they don't have all of the cognitive functioning to help be proactive in safety and in prevention efforts. And so thinking through things and working with them to be as safe as possible in whatever their decisions are is important versus telling them what they should and shouldn't do. But
That's that
yeah.
self-autonomy. I'm sorry. That's really self-autonomy really comes to mind with that. And I'm glad you're mentioning that. Let's spend just a little bit and talk about physical health and wellness,
Mhm.
because the data is all over the place when it comes to obesity rates,
Yes.
poor health rates, would be elevated cholesterol, hyperlipidemia rates, blood pressure, and so forth. Where are we right now with that adolescent male population when it comes to physical health and wellness?
It's a great question. It's the numbers depends on which study you look at, but we have significantly higher rates of obesity, and just even the definition of obesity keeps changing. Type 2 diabetes, which was pretty much unheard of in the 1980s, but in the 1990s and since then, the rates of type 2 diabetes have significantly increased among adolescents here as well as globally. Um, and um, and as a result, we're seeing more hypertension, cardiovascular disease in younger people. And people may have seen in the news over the last year or so, we're also starting to see a rise in cancers that not necessarily in adolescence, but in the 20s and 30s that weren't generally seen until people were in their 50s or 60s, such as colorectal cancer and um, breast cancer in young women. But all of these are believed to be related to multiple factors, but a big part has been attributed to a more sedentary life and eating habits. Um, and we know that, for example, mental health issues also affect our cardiovascular system. So it's multi-pronged.
Thank you again. This is to make sure that we're looking at the entire system, the person, how they fit into the community, how they fit into the health system is really important. And you bring a lot of that. As we close out today in our last couple seconds or minute together, what's your major takeaway for any of our listeners? What major takeaway would you like to share?
I would say that I'm a strong believer in using what's called the HEADS assessment, which is it's grown over the years, but it's primarily the H is for home and environment, and the E is for education, um, as well as can be used for employment or eating and exercise. So all those E's. Activities is the A, drugs or substance use. is very important. That's the D. And then the S, there are multiple S's. So sexuality, suicide and depression, mental health, and safety. Safety is violence. Are you around? Is there domestic violence present in your family or in your living situation? All of these issues, as we know as nursing, is part of the human experience and the environment, and it definitely impacts health. So all of that is important. I would say even in the home, one of my questions is I ask, how would you describe your relationship with your mother, and how would you describe it with your father, or if they have two mothers, with both mothers? Earlier studies have found that adolescents that identify not having a good relationship with their father, for example, regardless of gender. And I'm not talking about, oh, he gets on my nerves, or I'm mad at him because he took my phone away. That's not, it's the relationship, the quality of the relationship. If they say it sucks, I hate him, they're significantly more likely to use drugs. So these are all little red flags that we get in doing this thorough assessment. We have to be holistic, and we need to also start when we start working with adolescents at first, until they trust us and engage with us, we need to start with the least invasive. We don't want to start out with, do you own a gun and are you having sex? But we need to build trust and confidence with our adolescents and young adults. And not enough of that is being done across this country. So many adolescents are not being asked the right questions and are not being willing to engage with healthcare providers.
Thank you. Thank you so much, Dr. Nelson. That's a very powerful message, and I really appreciate your time. And thank you for your expertise as we share this with our viewers. So I appreciate your time. And thank you all for joining us for the Manifesting Health series. See you next time.
Thank you.